Can COVID infection increases the risk of getting heart diseases? If yes, how high is the increase? Hello everyone, I'm Yuan and welcome to my channel on Dr. Yuan Explains, where there's simple, fun, and reliable medical knowledge for everyone. For the video series of medical news updates, I would like to share the information on the medical papers or cases that caught my attention and any associated health tips as well. So I aim to upload a new video every Thursday. So in this video, I would like to share the recent finding on the increased risk of cardiovascular diseases for those infected with COVID-19. So previously, it was just a suspicion, but now there's concrete evidence from this US study, which is just published in Nature Medicine in February 2022. And also there's another follow-up commentary paper in JAMA in March. Just some background information, papers like Nature, JAMA, NEJM, Lancet are some of the top-notch medical papers in the field that healthcare professionals read. So what's so good or special about them? So the study design needs to be robust and it involves a huge population to get some conclusion or recommendations, and these papers are tightly scrutinized by panels of experts before it can be published. So in this video, let's go through one of the papers, then you could probably understand what I mean then. Okay, so what did they do in this study? So they basically looked at the database on US veteran health system that records all those who use the healthcare system and then decipher those who got COVID and recover in 30 days versus those non-COVID patients. So for your information, this system is the largest integrated healthcare system in US that serves active duty personnel, retirees, dependents, and military families. So in the results, there's about 153,000 ex-COVID patients from the data collected in the year 2020 and 2021, and the incidence of cardiovascular diseases was then compared with 5 million plus cases for those without COVID in the year of 2017 and 2019. So the older 2017 is used as a historical control. So from the overall data, the average age is about 61 years old and is 89% of males and about 71% of white people. So let's look at the data. For 12 months post-COVID, for every 1,000 people, there's an increase in cases accordingly for all the main cardiovascular diseases. So adding all the cases up, there's an overall 45.29 extra cardiovascular cases per 1,000 people who actually got COVID. So it's a maths calculation, that's why there's some decimal places. So for normal people like us, what it means is that in 1,000 people who got COVID, so there's an extra 45 people who will get some form of cardiovascular disease. So over here, you can see there's a short form here called MACE. It actually refers to the major adverse cardiovascular events, which actually includes all the data of cardiovascular death and hospitalization for heart failure or heart attack, which is also called myocardial infarction. So the increase of this major events is an extra by 23.48 cases per 1,000 ex-COVID patients. So next, let's go through some of the common cardiovascular diseases which are mentioned in this paper. The highest increase in cases can be observed for dysrhythmia, which actually refers to all the irregular heartbeat diseases, like if it can be too fast, too slow, or with an irregular tempo. Disease such as atrial fibrillation and sinus tachycardia falls into this category. So if you use the cha-cha dance as an example, so if the normal rhythm should be boom chap chap boom chap chap, so if it's too fast it'll be boom chap chap boom chap chap boom chap chap. If it's too slow it'll be boom cha cha boom cha cha, and if it's irregular it can be boom cha cha boom boom cha. So similar for the heartbeat, it can be lup dup, but it can be too fast, like lup dup 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 dup, and it may be irregular, like lup dup 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 dup. So Moving on to the next section, so we can see that the more severe form of COVID that a person has experienced, as seen in the label whereby the purple bar indicate the ICU ones. So the person has a higher risk of getting or developing cardiovascular diseases. So again, the most prominent case increase is seen for dysrhythmia. These data have been adjusted for other confounding factors such as age, race, and any other pre-existing medical conditions that the person have, such as diabetes and hypertension. So therefore, the data that we see here is truly based on COVID itself as the factor that increases all these cases. It is hypothesized that the COVID virus infection leads to continued activation of the immune, inflammatory, procoagulant cascade, but more studies are required to confirm this. So, a very simplified explanation of this theory is that the virus triggers inflammation, which then initiates the clotting. So, excess inflammation and clotting mechanism activation leads to the progressive development of these cardiovascular diseases. Another short note is on the risk of myocarditis and pericarditis. So, whether the person is vaccinated or not, the risk remains the same. So, vaccination in the elderly does not increase the risk of heart inflammation. So, last but not least is the take home message of the paper. So, what do you think? Is the increase in cardiovascular cases a lot for you? So, nevertheless, this paper is also a good reminder for all of us that for elderly people above 55 years old, especially those with other healthcare conditions such as hypertension, type 2 diabetes, and high cholesterol, with a strong history of cardiovascular disease, need to keep an eye on their cardiac health. For those ex-COVID friends, we need to be more alert on the signs and symptoms of cardiovascular disease, such as chest pain or discomfort or any palpitation. If there's any doubt, just quickly do a cardiac checkup. Don't delay. So, another point to share that the early symptoms of heart attack, such as chest pain and discomfort, can possibly be felt as pressure squeezing, burning, or fullness sensation. So it's actually an indication that the heart is running low in oxygen when the cardiac cells are trying their very best to survive. So the pain or discomfort is actually a way that our heart is screaming for help and immediate attention. These symptoms may be mild and inconsistent, but if it persists longer for a few hours, it's good to have a quick check at the hospital. So if you're healthy but at a retired age, it's always good to do a stress test every 2 to 3 years for any early detection. During the stress test, we need to run on the treadmill and to monitor the heart signals of ECG. So exercise is also an example of exertion, and any minor or early signs of abnormalities in the ECG can be revealed. This is because some blockage of the heart vessels are minor and they can still function properly to channel sufficient blood supply when we carry out our normal daily activities. However, during exertion or strenuous activities such as exercise, the blood supply through the narrowed blood vessels may not be sufficient, causing injury to heart cells or even cell death. Don't worry if the stress test sounds scary in a way. It's done under strict medical supervision, and the cardiologist will interpret the ECG for further ordering of tests for further investigation. So, if you're interested for more videos on cardiovascular disease, do comment and let me know too, then I can film accordingly. Thank you for watching, and I hope that the video is useful for you. You're more than welcome to share the video and subscribe the channel for further video updates. Have a good